The coronavirus has spread to countries across the world, but officials believe that it all started in Wuhan, China.
The entire purpose of this is to scare, the Jesus out of everyone. So then when next year comes, or even September, October of this year, when the flu season comes, people basically blindly say, yeah, chip me up. Yes, I'll accept a vaccine card. Yes, I'll have to get vaccinated before I get my driver's license. I'm willing to, show my little vaccine card before I go to the gym. Total control.
Hundreds of Wuhan business owners went out to protest because their businesses cannot survive, only to have authorities crack down on the gathering. The White House also criticized VOA for taking China's reported death toll as the truth and for comparing it with US data. VOA is founded by American taxpayers, but the administration says the outlet too often speaks for Americans' adversaries, including China.
The coronavirus has spread to countries across the world, but officials believe that it all started in Wuhan, China.
There are now more than 126,000 cases across more than 100 countries.
A new study to help us better understand the CCP virus and its global spread. NTD's Catherine Wen has the details.
A new study by European researchers found 3 different types of the CCP virus spreading around the world. Microbiologist Sean Lin says this further confirmed scientists' belief that the virus is constantly mutating.
First, the SARS-CoV-2 virus did mutate aggressively in human body in different regions. Secondly, the virus may undergo further adaptation when it encounters different races in different continents.
Based on virus genomes from the earliest cases, the report traced the family tree of the virus from December to March across the world. Among the 3 types found, A, B, and C, the most common found in the U.S. was the original virus, type A. Wuhan, the original epicenter, was mainly hit with type B, an early mutation of type A, and type C, daughter of B, got into Europe via Singapore. Lin says this research also proves all cases linked to Wuhan.
These report clearly suggesting that all these cases can be tracked back to Wuhan, China, and the Chinese communist regimes claiming or blaming the United States or Italian as a source of or the origin of the outbreak. Those kind of claims are totally groundless.
Mount Sinai conducted another study, published this week. It suggests the virus in New York was brought there by people arriving from Europe. It also shows a case of the virus in Washington state came from Wuhan, which agrees with the study mentioned earlier. Reporting by Catherine Wen, NTD News.
If you were the President of the United States, how would you stop an impending global takeover when many of the conspirators hide inside your own government? Remember, you need legally obtained evidence of actual crimes, otherwise the lamestream media will say you're a dictator and the Democrat swamp creatures will push for another bogus impeachment. We are quite literally watching a biowarfare drama play out before us, which my sources predicted would happen back in 2018. And for clarification, this individual was not a U.S. intelligence source. Rather, this came from an individual who worked for G7 security, specifically related to biological weapons, and participated in biological weapons theater that was ongoing in 2018.
The creation and intentional release of the Clade X virus.
We can't retreat from the rest of the world.
Continuity of government here cannot be overestimated.
Federal quarantine of this scale is unprecedented.
The question everywhere, when will there be a vaccine?
Bill Gates has helped to fight AIDS, tuberculosis, and malaria. He announced that his project called CCP will go to preparing for the next great epidemic.
A new way of building vaccines that could let us develop in less than a year a novel vaccine.
To understand who is behind this, let's remember that oftentimes the deep state uses cart before the horse tactics. So let's start with solutions. Who's offering them, when, why, and what are they? The name Bill Gates stands out because he seems to be the tether tying this whole scheme together. Microsoft co-founder Bill Gates, whose foundation has pledged billions of dollars towards manufacturing possible vaccines for the novel coronavirus. Is atheist Bill Gates a prophet, or did he have advanced knowledge of a tyrannical rollout? Anyone else find it coincidental that Dr. Fauci is on the leadership council for the Bill and Melinda Gates Foundation? Recognize her from the coronavirus task force briefings? Dr. Deborah Birx, well, looky here. Her daughter, Laura Birx, works for the Bill and Melinda Gates Foundation. Well, here's another interesting coincidence. The Johns Hopkins Center for Health Security, in partnership with the World Health Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201.
The high-level simulation exercise for pandemic preparedness and response, hosted by Johns Hopkins Center for Health Security, the World Economic Forum, and the Bill and Melinda Gates Foundation.
A high-level pandemic exercise on October 18th, 2019 in New York, New York. The Johns Hopkins Center has been the primary data source for tracking coronavirus cases. Many U.S. outlets reference them, and the Trump administration uses their data sources to make important decisions regarding the nation's welfare. So, turns out, Johns Hopkins and the World Health Organization have been padding their numbers. Wow, another coincidence.
Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright?
And let's say the virus caused you to go to the ICU and then have a heart or kidney problem. The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. Fear is a great way to control people.
Bill Gates has become the World Health Organization's second biggest donor. Given the high production level of Event 201, which was held in last October, this had to have been planned months in advance, maybe years. AKA my source talking about biological weapons theater in 2018. So when CNN falsely claimed Pentagon sources knew about the pandemic last November, which the Director of National Intelligence had to call out as fake news, we can assume that it was the World Health Organization, the Johns Hopkins Center, and most likely the Bill and Melinda Gates Foundation that were CNN's sources of foreknowledge of the pandemic. Are you starting to see the big picture yet?
The high-level simulation exercise.
Speaking of advanced knowledge, Apple, Facebook, Tesla, and SEUI Bank so graciously donated their stockpiles of N95 masks to the U.S. government, in tandem with AG Barr's threats to criminally go after hoarders and market manipulators.
I want to stress that we're not talking about consumers or businesses stockpiling supplies for their own operations. We're talking about people hoarding these goods and materials on an industrial scale for the purpose of manipulating the market. But if you are sitting on a warehouse with masks, surgical masks, you will be hearing a knock on your door.
Apple had 9 million masks, Facebook 720,000, Tesla 250,000, and SEUI Bank had approximately 40 million N95 masks. Did they have advanced knowledge which allowed them to stockpile supplies, thereby creating an artificial shortage, exacerbating the pandemic? According to Cook's tweet, Apple's operations team is using its supply chain to source, procure, and donate the masks, which helps explain how Apple was able to obtain so many masks in such a short time. Yeah, Sure. Sounds like Tim Cook is having a hard time making excuses for his stockpile. When you're spying on everyone, it would kind of be hard not to have advanced knowledge. Well, if quarantine blues have got you down, never fear, because Bill Gates is here with a solution. Yep, a new COVID-19 vaccine that's already entered into human testing.
The efficacy of vaccines in older people is always a huge challenge. It turns out the flu vaccine isn't that effective in elderly people. We clearly need a vaccine that works in the upper age range because they're most at risk of that. And doing that so that you amp it up so it works in older people and yet you don't have side effects. If we have, 1 in 10,000 side effects, that's, way more, 700,000, people who will suffer from that. And that actual decision of, okay, let's go and give this vaccine to the entire world, governments will have to be involved because there will be some risk and indemnification needed.
So now he admits that giving old people the flu shot was ineffective. Therefore, he wants to ramp up the COVID-19 vaccine, which could potentially cause more side effects, but he wants immunity for it. Politico named Bill Gates the world's most powerful doctor.
Dr. Shiva exposing Dr. Fauci, Dr. Birx, Bill Gates, and the World Health Organization COVID-19 endgame. Yes, welcome back to the Next News Network. He exposed everything that the deep state is trying to hide about the coronavirus. The interview went mega viral. Now, if you don't know Dr. Shiva, he specializes in finding solutions through a biological engineering systems approach, or in very simple terms, what he does is eliminate the need for animal testing by replicating those same processes on the computer. Now, over the last weeks and months, Dr. Shiva has been focused on the science as well as the fake science and claims made by the World Health Organization, supported by Dr. Fauci and Dr. Birx, who are, now we're learning, have ties to the deep state, the Clinton Foundation, as well as the Gates Foundation. So it's clear to see now that their exaggerated pandemic projection numbers, which they have consistently lowered, the original numbers, willfully promoted by the corporate-approved media, led to a panic-driven, disastrous global economic collapse. And today, we're happy to have him back to update us on his latest research and the real agenda that is being pushed through what he calls the greatest fraud on America to manipulate the economy, suppress dissent, and push mandated medicine. Dr. Shiva, welcome back to the show. Let's get straight into it. Bring us up to speed from when we spoke last and tell our audience about your latest findings.
Sure. Great to be here, Gary. I think there's two findings. What's going on, Gary, is we have the intersection of the issues of health and science along with politics. So it's a fascinating world we're in. And I feel, frankly, very, very honored to be able to share the knowledge that I was fortunate to be able to acquire through my education here in the United States and, growing up in Jersey, et cetera, which I've shared about before. But the key things are there's two events taking on. You have the political aspect, which I talked about in that tweet. I think that tweet really brought up those three aspects, right? This entire fear mongering is really the essence of it is to suppress dissent, right? The second part of it is to crash the economy. And the third part of it is to push mandated medicine. And I still stand by that. And what we've seen since that tweet came out is essentially, everyone showing their cards. That's what's really happening. So let's talk about Fauci. Since we spoke, we ran a campaign to fire Fauci. And I frankly believe this individual should be indicted and should be fired, and all sorts of charges should be leveled at him because he's essentially been the mastermind of an organization for many, many years across many, many presidents, which has promoted a fake science that the immune system is so weak and that you always characterize some virus as a cause of destruction to the immune system. He did this with HIV and AIDS. You have the Gates, you have Zuckerberg, and you have the Clinton Global Initiative, who are all about vaccines, vaccines, vaccines. So their entire opportunity is, we talked about early, and the trajectory of which I characterized early on as the entire purpose of this is to scare, the Jesus out of everyone. So then when next year comes, or even September, October of this year, when the flu season comes, people basically blindly say, yeah, chip me up. Yes, I'll accept the vaccine card. Yes, I'll have to get vaccinated before I get my driver's license. I'm willing to, show my little vaccine card before I go to the gym. Total control.